We did have a lot of dislodgements at our hospital. And so, when you go place a pick and then a few days later you get another pick order and you recognize the name, it's a little frustrating, not just as clinicians and the time that you spend, but also for patients that have to go through this procedure all over again. So when we found SecurAcath and found out what it could do, it really was a no-brainer for us. And then once we started using the product and found out other things that it could do, like the lines not pistoning in and out and not having to change adhesive securement device with dressing changes, because ultimately then your lines are very unprotected in that moment. So knowing that the securement piece was in there for dressing changes also just made it a no-brainer.
As the end user, when I first started at the hospital, I was in the infusion center, so I wasn't a vascular access specialist at the time, but I had been a nurse for 8 years prior to that doing dressing changes, and the SecurAcath was a game changer when it came to that, because I didn't have to hold my breath every single time I peeled the tape off, hoping the line didn't come out just a little bit more. One time I had an experience at a different facility where I pulled the line out on a night shift, completely out doing a dressing change. So these were amazing to me.
Dressing changes, I think, also have become much faster for nurses. Our kits, our custom kits no longer have an adhesive securement device because we just don't use it that frequently. So in order for nurses to use that, they have to drop it onto the sterile field. Of course, if we have our SecurAcath in place, there's nothing else they need to do. They just open their kit and they can change their dressing. And it's sometimes a matter of just minutes to get a good quality dressing change for a patient.
Seeing these lines staying in, especially for some patients who are very difficult stick, it's just very reassuring.